Today's topic is signs and symptoms of leukemia in adults. Introduction. Leukemia results from producing a vast amount of abnormal white blood cells in the bone marrow and the body's lymphatic system. These abnormal white blood cells are called blasts. It is cancer in blood-producing cells. Method of diagnosis. Usually we perform blood count technique and bone marrow examination to diagnose leukemia. Types of leukemia. Acute leukemia. Acute leukemia is common in children. It happens due to an increasing number of immature white blood cells in the body, which can lower hemoglobin levels and platelets. It must treat it immediately, otherwise can cause dangerous outcomes for the patient. Chronic leukemia. It happens due to the production of many abnormal but mature white blood cells in the body. As compared to children, it is more common in adults. Its treatment is a delayed process to ensure maximum efficacy, but if preventive measures aren't taken as soon as possible, it can result in patient death. Lymphocytic leukemia. If abnormal lymphocytes are produced in the body, then they can cause lymphocytic leukemia. It infects our immune cells and weakens our immunity. Myelogenous leukemia. If abnormal lymphocytes are produced in the body, then they can cause myelogenous leukemia. It infects our red blood cells producing cells. Signs and symptoms of leukemia in adults. Leukemia is due to abnormal blood cells like white blood cells, our pathogen-fighting cells, and red blood cells, our body's oxygen center. It spreads in cells in the bone marrow and the body's lymphatic system where these cells are produced, causing abnormality in their production. We can imagine that forcing the production of abnormal white blood cells can damage our immunity and cause our body prone to various bacterial and viral infections easily. Also, the production of an abnormally large number of white blood cells can decrease our body's oxygen levels and damage our lungs, ultimately causing the skin to be pale. An excessive amount of white blood cells can also cause thinning of our blood, which can cause internal and external bleeding. By cutting it short, the leukemia symptoms vary according to their kind, whether acute or chronic or specific blood cells. Typical leukemia signs and symptoms are as following: flu and high fever, continuous or serious inflammation. Various infections cause diseases like tonsils, pneumonia, and diarrhea. Tireless weariness and fatigue, shortness of breath, enlarged liver or spleen, weight lose, minuscule red spots on the skin, swollen lymph nodes, thinning of blood, frequent bleeding from the nose, bruises on skin, pale skin, frequent sweating, particularly around evening time, bone weakening. Causes of leukemia. No specific cause of leukemia is still known. According to the research, genetic mutation that can trigger tumor cells and carcinogens in the body can cause leukemia. Smoking and exposure to ionizing and non-ionizing radiation are also considered as the cause of leukemia. Treatment. Proper medication, radiotherapy, and bone marrow treatment are effective in treating leukemia. Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.